Welcome to Final BDS Made Easy. Host modulating agents is an important 5-marker question in the subject of periodontia. Host modulating agents are therapeutic agents designed to modify the host's response to periodontal pathogens, thereby controlling periodontal disease progression. Unlike traditional therapies that focus on reducing bacterial load, host modulating agents aim to balance the destructive and protective mechanisms within the host's periodontal environment. Mechanisms of action. Host modulating agents work by inhibiting matrix metalloproteinases. MMPs are enzymes that degrade collagen and other extracellular matrix components. HMAs such as subantimicrobial dose doxycycline inhibit MMP activity, thus reducing tissue destruction. They also modulate inflammatory response. HMAs can reduce the production of pro-inflammatory cytokines, example interleukin 1 beta, TNF alpha, and enhance anti-inflammatory cytokines, thereby decreasing tissue inflammation and damage. They also regulate bone metabolism. Some HMAs influence bone resorption and formation. For instance, bisphosphonates inhibit osteoclast-mediated bone resorption, preserving the alveolar bone. Systemic agents include the NSAIDs. They inhibit prostaglandins, particularly prostaglandin E2, thus reducing tissue inflammation. They block prostaglandin E2 production, reducing inflammation and inhibiting osteoclast activity. Short-term NSAID administration reduces GCF-MMP8 levels. Long-term NSAID use can slow alveolar bone loss but has significant side effects like GI problems, hemorrhage, renal and hepatic impairment. Discontinuation can lead to a rebound effect with accelerated bone loss. Selective COX-2 inhibitors, initially promising, were linked to severe side effects like myocardial infarction. Bisphosphonates are bone-seeking agents, inhibiting bone resorption by disrupting osteoclast activity. They demonstrated increased bone density and reduced alveolar bone resorption in animal models. Human studies showed enhanced alveolar bone status and density. Associated risks are inhibiting bone calcification, changes in white blood cell counts, and avascular necrosis of the jaws. Another systemic agent is the subantimicrobial dose doxycycline. 20 milligrams dose of Periostat is approved for chronic periodontitis as an adjunct to scaling and root planing. It inhibits enzymes, cytokines, and osteoclasts without significant antibiotic effects. Studies show significant clinical benefits when used with scaling and root planing, noted additional gain in clinical attachment levels beyond mechanical therapy alone. FDA approved for chronic periodontitis. Locally administered agents again includes NSAIDs. Topical NSAIDs, example ketorolac mouth rinse, reduced GCF levels of prostaglandin E2 and halted bone loss in studies. Not yet approved as local agents for periodontitis management. Other locally administered agents are the enamel matrix proteins, growth factors, and bone morphogenetic proteins. They are investigated for adjunctive use in surgical procedures to stimulate regeneration of periodontal tissues. Enamel matrix proteins like emdogain has been approved by FDA for clinical attachment gain and wound healing. Growth factors like recombinant human platelet-derived growth factor (BB) is approved for regenerative procedures, and bone morphogenetic proteins like BMP2 and Infuse are used for ridge and sinus augmentation. Potential adverse events include osteolysis and increased neurologic deficits. These agents aim to restore lost bone, periodontal ligament, and cementum. Clinical applications of HMAs are that they are used typically as adjuncts to conventional periodontal therapies, that is scaling and root planing. They are particularly beneficial in patients with chronic periodontitis who do not respond adequately to mechanical debridement alone. Individuals with systemic conditions like diabetes that exacerbate periodontal disease. That's it. Thank you for watching. If you appreciate this video, do hit the like button and please subscribe to my YouTube channel. Stay tuned for more such videos.